This quick video will show you how to use your lanyard to access the Multiplate component of the ROTEM algorithms. Posters displaying the QR code are also available in critical bleeding areas, including theatres and ICU. Multiplate is a platelet function test done in a lab on Level 4 of Randwick Campus Centre. It is useful for patients on antiplatelet therapy, especially prior to surgery, to assess whether surgery can proceed safely. This audit is to determine how often a patient, for example on clopidogrel preoperatively, is able to proceed to theatre ahead of the usual 5-day waiting period. This will allow safety of the algorithm to be evaluated and help us to continue access to use this machine for this indication. This local data will be used to guide the ongoing success of this project. The studies on this are mostly using Herugen green tops, which are available in cardiac theatres and on the pre-op cardiac wards. 2 Herugen tubes are collected and must be hand-delivered as the automatic chute delivery system can damage the platelets. If the lab is informed beforehand on extension 23482, then the technician and the machine will be ready when the sample arrives and the results should be available in 30 to 45 minutes. The red and green zones guiding risk of bleeding with a given platelet function result is an evolving area of research. It is important to note that just like a hemoglobin result that is slightly low will not require transfusion, the red zone for multiplate action is at a level which defines enhanced risk for surgical bleeding and is not the same as the population norms. Any staff member can complete this audit when requesting and analysing the multiplate result. Essentially, we are looking at whether surgery can proceed earlier than planned, potentially reducing bed occupancy. Following this, we will then look at patient safety and outcomes. First, the audit asks for simple data, such as patient's weight, MRN, and which hospital you are from. Then choose Test Type, Multi, from the drop-down menu, and tell us whether you are using the Multiplate ROTEM algorithm for cardiac pulmonary bypass or general cases, or are you using the children's algorithm? Next, choose the test scenario, which will usually be pre-op. This has additional educational information for junior doctors included to which patients are likely to need platelets available for their upcoming surgery. If using the pre-op algorithm, you will then be asked if the surgery proceeded earlier than planned, did you arrange platelets for theatre, and did you follow the algorithm? Please include any additional information in the free text. Sometimes a multiplate is done during cardiac surgery or after protamine. Images of the decision support for cardiac surgery are included. Please answer just a few questions about whether you will give platelets if they bleed. Did you use dd-AVP? And did you give platelets? Please record 0 if not. Finally, did you follow the algorithm? And please explain if not, as this helps us to review the algorithms which are updated every 3 years. Don't forget to press Submit at the end so the line of data is sent to our data form for analysis. No data about the person sending the information is kept, so it doesn't matter whose phone is used to complete the questions. Thank you for helping the ROTEM Working Party collect data on the use of the Multiplate machine before and during surgery, which will be used to enhance this quality and safety project.